Hello everybody, welcome to PD Nursing Corner channel. And here is another insight which we are going to expose on the lethal rhythm, continuity from the ventricular tachycardia. We are jumping into ventricular fibrillation. So what is ventricular fibrillation? It's something really fibrillating my brains as well. So fibrillation is nothing but the chaotic movement of the heart. So here the heart is having the chaotic movement on the ventricles. Yes, we can further go into the nursing care of patient with ventricular fibrillation. So as I told you earlier, so it is a chaotic movement of the heart, especially the ventricles. So which we call a mnemonic word, which is quivering of the heart rather than normally beating. So usually we know that the conductive activity of the patient's heart will be starting from the SA node, will be traveling into the AV node, and then from that passes into a big vector is being created, and it goes into the bundle of His, and then finally into the left and the right. So in case of a ventricular fibrillation, there is a chaotic movement all over the ventricular where the vector bonds is too confused whether it is to be led to the left or right. Instead, it is functioning in a quivering motility. So here coming to the 5 important aspects as to read the ECG. When you check out the rhythm is always chaotic in nature. When you check out the rate of the heart rate is also chaotic. So you cannot predict whether the patient is having tachy. It's you cannot give the exact one whether the patient is having 150 or 180 the heart rate. And I think and I suppose that you can't see any ECG wave predicting to the atrial activity. I can only see the ventricular activity. There is no chance of any of the AP wave in this ventricular fibrillation. And as well as I told you, the PR interval is always observed whether it is regular or irregular. So here the PR interval is totally absent because always, as I told you earlier, the P wave itself is missing into the thing, so we can plan in for the that is definitely the PR interval is absent in this ECG, and the QRS complexes are also absent. So in short, the medical professionals, we call this ventricular fibrillation as VFib. So this is like patient is not having any good cardiac output in case of a ventricular fibrillation. So we have to plan in for starting with defibrillation, not delaying the time. Starting with, in case of a monophasic, you start with the dose of 360 joules, and in case of a biphasic, you start with joules of 120 to 200 joules. Followed by that, we are going to administer injection adrenaline, which is epinephrine 1 milligram IV, followed by a flush, and then you're going to give the drug continuously of every 3 to 5 minutes and so on. So in this, you can also further divide, like as we saw earlier in ventricular tachycardia, you have a monomorphic VT as well as a polymorphic VT. So in case of ventricular fibrillation also, you have fine ventricular fibrillation and post-ventricular fibrillation. So from the picture itself, you can assess that these are fine, that is very, very small in nature, the QRS complexes, and you can't see a P wave. Post-ventricular fibrillation, some sort of chaotic activity of the ventricle is happening. So what can be the possible nursing management for a patient of ventricular fibrillation? The same drug of choices can be started as we saw in VT, procainamide, amiodarone, lidocaine, and solatotol. As well, we have the protocol regimen that is starting with the early defibrillation and responding to the CPR. And if the patient is responding, then plan for 3 shocks, and after the 3 shocks are delivered, we are going to start in with administration of medication such as epinephrine adrenaline 1 milligram IV and amiodarone 300 milligram IV, which is a cardiac antiarrhythmic agent. Followed by that, again you start the CPR, and after the 5th shock, you are going to again administer amiodarone of 150 milligram IV. So this is a small one which I wanted to share to you, that is the ACLS guidelines, which is taken from the AHA. So this is nothing but the CPR of ACLS when the patient is going for ventricular fibrillation, what is to be done and not. So I hope so you enjoyed the major focuses on what are the major changes in ventricular fibrillation and how it can be dealt, right? Hope you all enjoyed the video, and thank you for your patience listening. Please don't forget to subscribe and pass on the channel to your friends and comment on the box. Thank you.